Good morning. This is Dr. McDaniel. Ooh, I forgot my microphone. I hope I'm reasonably audible. Let me just throw this in because I know it sounds like I'm kind of far away if I don't have this microphone attached. So 1 second. Forgetfulness on a Monday. So let's see, today's Monday and I'm speaking. Yesterday I spoke about follicular cyst. I'm going to continue that vein today. So follicular cysts are cysts of the ovaries that are normal. They're supposed to occur if someone is fertile at reproductive age. So a cyst is a pocket of blood, any kind of pocket or collection of fluid. I don't know why I said blood. A fluid or liquid or blood is considered a cyst. And follicle is the term we have for an egg of the ovary. So when someone has a follicular cyst, they have a cyst that's representative of an egg from the ovary that's developing, and it's going to rupture or pop to release that egg. So everyone who's not on birth control pills, just their natural God-given cycles, they should have 2 cysts every month. The first cyst of the ovaries is that follicular cyst. So the brain tells the ovaries to start producing eggs once the menstrual cycle has completely finished. It's cleaned out, you have fresh slate of the uterus. So the brain tells the ovaries to start producing eggs. The ovaries produce estrogen or hormones to support that egg development or those follicles. A lot of follicles are recruited to start growing, and it's a little bit of a competition. So once that person starts to have an egg or a follicle represented by a cyst that gets between 18 and 22 millimeters on average, it's then the ovaries spike in their hormones, progesterone and estrogen, and that allows the cyst or that pocket of fluid to pop open, to burst, to rupture, and to release that egg. We call that scenario ovulation. Now, on average, most women don't feel when they ovulate, even though they've just had a cyst that's ruptured, because it's relatively small. 18 and 22 millimeters is a little under 2 inches. If that cyst happens to get quite large, just for whatever random reason, so instead of being 2 inches or the size of a marble or a walnut, if it gets, well, walnut is probably going to be more like 2.5 to 3 inches almost, but if it gets larger than that, say it gets the size of an apple or the size of an orange, which can happen, the woman is usually going to feel some achy discomfort pressure while it's getting that large, and then when it pops or ruptures, it's going to be quite a bit of pain, excruciating pain, similar to someone having appendicitis or diverticulitis of the bowels, because you get quite a bit of fluid released in the abdominal pelvic cavity. That fluid is very irritating. It's an inflammatory process of the lining of the body, and it'll have that person doubled over in pain, incapacitated until the fluid starts to get soaked back up into the body. So usually what happens if someone has a pretty large follicular cyst, it ruptures, they have symptoms of pain and discomfort and everything, they'll go to the emergency room or urgent care because they don't know what's going on. They're in a lot of pain. Whenever someone can feel that ovulation occur, feel that the evidence or the effects of that ruptured cyst, we call that a symptomatic follicular cyst. So she had a symptomatic follicular cyst, or what we call functional cyst, because it's a cyst that allows the reproductive system to function. So if she's symptomatic and it's just like, oh, I have a little cramping, it's a little uncomfortable every month, it's really annoying, then we can treat her by just stopping her from ovulating. And the only way we can stop someone from ovulating is birth control methods. So either birth control pills or the shots, the implant, or the NuvaRing, because those are the hormonal contraceptives that prevent someone from ovulating. Birth control pills do not stop the IUD does not stop ovulation. Only birth control pills, the ring, the shots, or the implant. But the IUD, that person will still ovulate. So if she goes to the emergency room or urgent care, she'll always be evaluated to see what the source of the pain is, and that will include an ultrasound or a sonogram. They should see evidence of a ruptured cyst with fluid, and then one of the ovaries having a little bit of cystic representation present also. And then she should be monitored to confirm that her blood level is not dropping, because every once in a while, small percentage of the time, when someone has a large follicular cyst that ruptures, it can potentially disrupt blood vessels or the vascular supply, and it can cause bleeding from that ruptured capillary or arterial. And if she has quite a bit of bleeding, then the fluid that we see in the belly is not just the clear, watery, liquid fluid, or what we call serous fluid of that follicular cyst. It is also blood that's accumulating. So if she goes to the emergency room or urgent care, she's evaluated. They should keep her there for a couple of hours, check her blood level, and make sure that she's not bleeding into the belly, even though it is a normal cyst of ovulation that occurs every month. Now, if she goes to the urgent care emergency room, or she comes into the office because she's having a lot of pelvic pain, discomfort, achy pressure, but it hasn't actually ruptured, then we're not going to operate on her for that. She will be monitored. So what most gynecologists will recommend, myself included, we recommend that she start a birth control pill straight away if that cyst is 5, 6, 7 centimeters or larger. So if it's the size of an orange, a sun-kissed orange or something, that's quite large. So we will usually recommend that she start a birth control pill straight away to try to decrease activity of the ovary, and then give her body time for that cyst to either pop, release the egg, or to slowly just shrivel up and shrink. It will decompress. If someone is found to have dropped their blood level in the emergency room, then it depends on how quickly it's dropping, because it will seal off. If it's not an artery that's pumping, it will seal off, it'll clot off, and it'll stop. So you don't just check 2 blood levels, because it may have been that you checked her when she first came in. That didn't reflect when she was first really seen. It reflected maybe 30 minutes prior, and then you checked her again in 30 minutes. Now the levels drop, but you don't know if it's maintained now. So you want to check her 1 or 2 times more, just to confirm that it's not continuing to drop. Maybe it's stabilized and she doesn't need anything done. If it does continue to drop, or the patient is symptomatic because she's becoming more anemic, then she will need surgery to have the bleeding assessed and sutured or sealed off. So I hope that's been helpful. That's all I can think of right now for follicular cyst. So follicular cysts are normal cystic changes of the ovaries that, if you're not on birth control, will occur every month. If your reproductive age, you're getting menstrual cycles. Most women do not have symptoms of their follicular cyst. It's a functional cyst, allows the reproductive system to function normally. Every once in a while, or occasionally, someone will always have symptoms every month. If it's disruptive, it's bothersome, she's in a lot of pain, then she can be treated for that with birth control to suppress ovulation. If she doesn't ovulate, she doesn't get the cyst. If she's doubled over in pain, she goes to the emergency room or urgent care for it, then she'll need to be monitored to confirm that she's not bleeding into the belly and that the cyst is stable. And if it is, then she doesn't need any intervention. If it isn't, then she'll need to go to day surgery, laparoscopic intervention to manage the bleeding. Thank you very much. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. It's also called GYN Corner. And like, subscribe, comment. If you have questions on any of the discussions I've given, please post your questions here, or if you have a topic that you'd like for me to address that's obstetrical, gynecological, anything for women's health, 99% plus of the time I should be able to answer it, since I'm a gynecologist. Thank you. And I've been practicing for almost 30 years now, 30 years. Please also check out our website for the office. It's midtowngyn.com. We see walk-ins every day. Saw a walk-in already today. So just call for the office hours. Call for the walk-in hours for the office the day you want to come in. If we're open, we have walk-in hours. Thanks a lot for joining me. Have a great rest of the day. See you back on Tuesday.